Imagine waking up one day and realizing your entire identity is tied to your job, only to have it ripped away by an unforeseen health crisis. That's the stark reality for millions of Britons grappling with long-term sickness, and it's a story that's hitting closer to home than ever before. But here's where it gets controversial. Are these individuals truly malingerers, as some might whisper, or is there a deeper societal failure at play? Let's dive into this growing epidemic, unpacking the facts, the faces, and the fierce debates surrounding it, and see why this issue demands our attention right now. Meet Roni Jones, a 63-year-old from Cornwall, who used to scoff at folks taking time off work for what she called yuppie flu or being part of the worried well. As a former NHS manager and charity boss, she was the ultimate workaholic, until a garden collapse in 2021 changed everything. Diagnosed with multi-system dysautonomia, a serious neurological disorder, she now battles relentless, bone-crushing pain and exhaustion that makes even basic tasks like showering or leaving the house feel insurmountable. "I never thought I'd be on the other side of this," she reflects. "There's always been a stigma against those not working, and I fed into it, until it happened to me." Her story isn't isolated. She's one of 2.8 million people sidelined by long-term illnesses, unable to work at all. Fast forward to today, and the numbers are alarming. Since 2019, an extra 800,000 working-age adults, that's a 40% jump, are out of the workforce due to prolonged sickness. On top of that, 4.1 million report disabilities limiting their jobs, a 30% rise. If this trend persists, experts from the Center for Economics and Business Research and Zurich Insurance warn of a £66.3 billion annual hit to the economy by 2030 from lost output. Dr. Adrian Hayter, a 61-year-old GP with 30 years under his belt at Runnymede Medical Practice near Windsor, has witnessed this firsthand post-pandemic. "It's tempting to blame a sick note culture, but it's far more intricate, a web of factors pushing people out," he says. And this is the part most people miss. It's not just laziness. It's a complex tapestry of health, work, and societal pressures. So, what's really driving this exodus from the workforce? Picture a two-pronged assault. Mental health woes hitting younger workers hard at the start of their careers, while musculoskeletal issues plague those nearing retirement. For starters, let's talk about conditions that don't fully derail someone's job, but cap their capacity. Since 2015, the fastest growth has been among 16 to 34-year-olds, surging by 1.2 million, a whopping 77% increase, per the Department for Work and Pensions, DWP. Nearly half, or 530,000, cite mental health as the primary culprit. The next biggest leap? Workers aged 50 to 64, up 900,000, with 140,000 attributing it to musculoskeletal problems. When we zoom in on the 2.8 million fully out of work due to long-term sickness, the pattern echoes, though with more layers. Mental health tops the list, accounting for 28% of cases last year, as per ONS data. Breakdown by age: 14% are 16 to 24, half fall between 25 to 50, and over a third, 36%, are 50 to 64. Interestingly, while young workers rank lowest in this group, Mark Rowland, CEO of the Mental Health Foundation, points to a sharp decline in youth transitioning from school to stable jobs. This isn't just about one person dropping out. It's a massive economic and social drain that could ripple far wider if unchecked, he explains. Musculoskeletal issues come in second, affecting 21% of long-term absentees, with 71% in the 50 to 64 bracket. Other big players include chronic digestive, circulatory, respiratory, and nervous system diseases, like Roni Jones's condition, striking across ages. These aren't abstract stats. They represent real lives derailed by pain and uncertainty. Now let's unpack why mental health is surging as the leading cause. Rowland identifies four major megatrends. First, a positive shift. Less stigma means more people are stepping forward for help. But the rest aren't so rosy. Economic instability and widening inequality fuel the fire, backed by research linking low incomes to deteriorating mental health. During the 2022 cost of living peak, 21% of those without prior diagnoses told YouGov that financial worries were triggering depression. Hayter echoes this. noting a spike in patients stressed by money woes, especially in small firms where bosses pass on business pressures without safety nets. Small businesses, per the Chartered Institute of Personnel and Development, CIPD, are least equipped with occupational health support, leaving employees more vulnerable to burnout. That directly impacts who gets signed off with mental health issues, Hayter adds. Global upheavals like the pandemic, climate crises, and ongoing conflicts add existential dread and uncertainty. Then there's the digital revolution. The online world's unchecked expansion is intensifying work. Work intensification from digital tools might boost stress levels, says Ben Wilmot, CIPD's head of public policy, explaining how short bursts can sharpen focus, but chronic exposure breeds anxiety, depression, and even heart problems. The UK stands out in Europe. Half of British workers regularly put in extra hours, the highest rate continent-wide, according to the Institute for Employment Studies. Just a third feel in control of their work schedules, the lowest in Europe. No surprise, then, that heavy workloads are the top trigger for stress-related absences, as CIPD data shows. But here's where it gets controversial. Is this relentless digital push a productivity boost or a hidden hazard eroding our well-being? Many argue it's a double-edged sword we haven't fully reckoned with. Turning to musculoskeletal woes, the culprit is often plain, an aging population. There's no denying the graying workforce is a key factor, Wilmot says. Baby boomers, born 1946 to 1964, are retiring en masse, while birth rates in England and Wales have dipped below 2.1 children per woman annually since 1973, insufficient to maintain population levels. The UK's median age has climbed from 33 in 1973 to 40 now, putting upward pressure on inactivity, as the Office for National Statistics warns. Long NHS waiting lists exacerbate this. Hayter notes patients enduring pain while working worsens both physical and mental health. With 7.4 million on the waiting list in August, 40% over 4 months, per the British Medical Association. A third of economically inactive folks in a 2023 ONS survey were waiting for treatment, and a third of employed patients said it impacted their jobs. Untreated physical ailments can spiral into mental health crises, with 59% of long-term sick experiencing moderate to severe depression. I felt this crushing grief, Jones shares. No one chooses a wheelchair or joblessness or endless TV marathons. It's a poignant reminder that without timely care, small issues balloon into life-altering ones. But wait, could your boss be part of the problem? That's a question sparking heated debate. Are we scrutinizing how work quality fuels sickness? Asks Claire McNeil, CEO of TimeWees, a flexible working nonprofit. Employers aren't prioritizing the adaptability young people with mental health challenges need, like post-COVID entrants. We owe them morally sound jobs. In 2022 to 23, 1.77 million workers faced job-related ill health, costing 31.5 million working days, reports the Health and Safety Executive. Work-related stress, depression, or anxiety hit 875,000, while 473,000 suffered musculoskeletal injuries. These get overlooked by bosses and policymakers, Hayter laments. Inadequate management training is a culprit, persists Wilmot. Too few train managers on proper people skills. It's not rocket science, but it's crucial. This means setting clear goals, boundaries, and compassionate health approaches. A University of Nottingham and Queen's University Belfast study linked mental health training for managers to slashed long-term absences, yet only 29% of firms offer it. Managers aren't therapists, but their relationship is pivotal for workplace mental health, Roland notes. Employers overburden GPs too, Hayter says. We need consistent employer support for reintegrating workers, not doctors playing occupational health detectives. He recounts a case where a patient's gradual return plan was rejected by the employer, forcing more time off, mirroring data where 43% of firms lack well-being strategies. Yet, Jane Grattan, Deputy Director of Public Policy at the British Chambers of Commerce, sees proactive employers seeking solutions. They want to help, but external issues like economic pressures are beyond their control. This raises a controversial point. Should employers shoulder the full burden, or is this a systemic flaw demanding broader fixes? The government's £1 billion Connect to Work initiative aims to embed job advisors in GP practices.